As we move into the second quarter of 2026, public health agencies are facing a renewed and complex challenge from a familiar but increasingly volatile pathogen, the hantavirus. This month, a cluster of severe respiratory illnesses identified on a cruise ship in the Atlantic Ocean has brought global attention to the evolving epidemiology of this rodent-borne virus. Reports from the World Health Organization and the Centers for Disease Control and Prevention indicate that what was once considered a rare, sporadic threat is now exhibiting patterns of increased activity that scientists are directly linking to broader environmental shifts. The current framing of this hunting season for hantavirus focuses on how climate instability is altering the biological landscape, creating a perfect storm for zoonotic spillover. In the western United States and parts of South America, researchers have noted that shifting precipitation patterns and milder winters are driving significant changes in rodent populations. The primary reservoirs for the virus. These ecological disruptions lead to what biologists call masting events, where a surplus of food resources causes a localized explosion in rodent density. When these populations surge, the frequency of human-rodent interactions rises, particularly in rural and fringe ecosystems, where residential development meets wilderness. This is not merely a matter of more mice. It is a matter of environmental stress, facilitating the transmission of the virus within those populations, and eventually to humans. +3 hantaviruses are a family of viruses spread mainly by rodents, including the deer mouse, the white-footed mouse, and the cotton rat. Unlike many other viral threats, hantaviruses are not typically transmitted between humans, with one notable and dangerous exception, but are instead contracted through the inhalation of aerosolized viral particles. These particles are found in the dried urine, feces, and saliva of infected rodents. When a person disturbs a nest or cleans an enclosed space, like a shed or cabin where rodents have lived, these microscopic particles become airborne and can be inhaled directly into the lungs. Once inside the human body, the virus begins a process of rapid replication that targets the endothelial cells, which line the blood vessels. This leads to a catastrophic loss of vascular integrity. In the Americas, this primarily manifests as hantavirus pulmonary syndrome, or HPS, a condition characterized by the sudden onset of pulmonary edema, where the lungs fill with fluid, leading to severe respiratory distress and, in nearly half of all cases, death. The time frame for this current reporting cycle is critical. As of May 2026, the Global Surveillance Network is on high alert due to a cluster of cases involving the Andes virus strain. This specific strain is of particular concern to public health officials because it is the only known hantavirus capable of person-to-person transmission, usually through close physical contact or shared enclosed spaces. The geographic footprint is expanding, with official reporting now spanning from the South Atlantic to Europe and the Americas, forcing a reevaluation of how we monitor and contain this high-consequence pathogen in an era of rapid climate change. The core developments of the May 2026 outbreak began with a notification to the European Union's early warning and response system regarding a cluster of unknown respiratory disease on the MV Hondius, a Dutch-flagged vessel operating in the South Atlantic. By May 3rd, laboratory testing confirmed the presence of hantavirus, specifically the Andes virus strain, through polymerase chain reaction, or PCR, testing of samples taken from symptomatic passengers. As of the latest updates from the European Center for Disease Prevention and Control, at least 8 cases have been identified, resulting in 3 fatalities. This has triggered a massive multi-agency response involving the CDC, the WHO, and the National Institute for Communicable Diseases in South Africa. The logistics of this response are unprecedented for hantavirus reporting. Health officials are currently tracking and monitoring hundreds of passengers and crew members across several continents. High-risk contacts, defined as those who had close physical contact with symptomatic individuals, are being repatriated using chartered flights rather than commercial air travel to prevent any potential for further person-to-person spread. +2 in the laboratory setting, the diagnostic process for hantavirus is famously difficult because early symptoms, such as fever, muscle aches, and fatigue, almost perfectly mimic those of more common illnesses like influenza, COVID-19, or RSV. Public health guidance issued this week emphasizes that clinicians must look for specific epidemiological links, such as recent travel to endemic areas or contact with the cruise ship cluster, within a 42-day window. The CDC has noted that a single negative serum specimen collected within the first 72 hours of symptom onset is not enough to rule out infection. A second test must be conducted after that window to accurately detect the presence of IgM and IgG antibodies. This delayed diagnostic window is a major hurdle in treatment, as there is currently no specific antiviral medication or vaccine approved for hantavirus. Instead, clinical management relies entirely on early supportive care. This includes aggressive fluid management and, in many cases, mechanical ventilation or extracorporeal membrane oxygenation, CMO, to support the heart and lungs while the body attempts to clear the infection. The mortality rate for the American strains remains a stark data point, often cited between 35 and 50%, contrasting sharply with the lower fatality rates seen in the Old World strains of hantavirus found in Europe and Asia, which more commonly cause hemorrhagic fever with renal syndrome, or HFRS. The current crisis has forced agencies to prioritize not only diagnostic speed, but also strict isolation protocols for Andes virus patients, including the use of airborne infection isolation rooms and N95 respirators for all healthcare personnel. As the medical community grapples with the reality of a virus that is no longer strictly confined to rodent-to-human spillover, prevention and surveillance remain the primary tools in the public health arsenal, especially as the limits of medical intervention become clear. For the general public, the guidance from health departments is focused on rodent-proofing and safe cleaning practices. Because the virus is so easily aerosolized, officials warn against ever using a broom or vacuum in an area with signs of rodent activity. Instead, the standard protocol involves wearing rubber or plastic gloves and thoroughly soaking the area with a disinfectant, ideally a mixture of bleach and water, for at least 5 minutes before wiping it up with paper towels. This process inactivates the virus and prevents the deadly particles from becoming airborne. Furthermore, surveillance programs are being expanded to monitor rodent populations more closely. By tracking rodent richness and the prevalence of the virus in local wildlife, agencies hope to provide earlier warnings to communities before a spillover event occurs. However, there are honest limits to our current knowledge. Scientists still do not fully understand why certain years see a massive spike in viral prevalence within rodent colonies, or why some individuals develop life-threatening immune dysregulation, while others may remain asymptomatic. Shutterstock as we look toward the future. The narrative around hantavirus is shifting from one of bad luck in rural settings to a broader discussion about environmental management and global health security. The May 2026 cruise ship incident has highlighted the vulnerabilities in international travel and the speed at which a localized zoonotic event can become a global monitoring operation. Public health officials continue to stress that while the risk to the general public remains low, vigilance is essential for those in high-risk environments, such as construction workers, hikers, and those living in rural areas with high rodent populations. The 42-day monitoring period for exposed individuals remains a rigorous standard, requiring daily temperature checks and immediate isolation at the first sign of fever. As researchers continue to study the links between climate change and the expansion of rodent habitats, the goal is to move from reactive containment to proactive prevention. For now, the focus remains on the survivors of the recent cluster and the ongoing effort to ensure that the Andes virus does not establish a permanent foothold in human-to-human transmission chains. We will continue to monitor official statements from the CDC and WHO as more data from the laboratory investigations becomes available. For more updates on emerging public health reports and global surveillance, consider subscribing to our channel. The core developments of the 2026 hantavirus surveillance cycle have been defined by an unprecedented level of interagency cooperation as the World Health Organization and the Centers for Disease Control and Prevention respond to what they describe as a heightened period of viral activity. At the heart of this response is a significant focus on the diagnostic pipeline and the logistical challenges inherent in identifying a virus that often presents as a common respiratory infection. In specialized biocontainment labs across the globe, technicians are currently prioritizing the development and distribution of rapid molecular diagnostic tools, specifically focusing on polymerase chain reaction, or PCR, testing. Public health officials emphasize that because the early stages of hantavirus infection, including fever, chills, and severe muscle aches, are virtually indistinguishable from other seasonal viruses, the role of high-complexity laboratories is critical. When a suspected case arrives at a clinical setting, hospital protocols now demand a thorough investigation of the patient's recent environmental exposures, particularly any contact with enclosed spaces that may have harbored rodent populations. This triaging of risk is essential because the window for effective supportive care is narrow, often closing before a definitive diagnosis can even be returned from the lab. This year's reporting has been significantly shaped by the scientific community's insistence on the link between climate-driven ecological shifts and the rise in hantavirus cases. Experts from the National Institutes of Health and various environmental research groups are currently analyzing data that suggests the climate catastrophe mentioned in recent headlines is manifesting through drastically altered precipitation patterns. These shifts lead to sudden masting events, where an overabundance of seeds and vegetation causes a localized surge in rodent populations, specifically the deer mouse and the white-footed mouse. As these rodent populations expand and subsequently deplete their food sources, they are more likely to migrate into human structures in search of shelter, increasing the frequency of zoonotic spillover. In the laboratory, this translates to a higher volume of serum samples being screened for IgM and IgG antibodies. Scientists are carefully contrasting the claims of increased viral virulence with verified data, noting that while the virus itself may not have mutated into a more lethal form, the sheer frequency of exposure events is what is driving the current public health crisis. The data indicates that the intensity of the season is a direct reflection of rodent density, rather than a change in the virus's fundamental biological structure. Furthermore, the travel and logistics of public health reporting have been adapted to meet the demands of this heightened activity. Regional health departments are now coordinating with shipping and trade organizations to monitor for rodent infestations in international transport hubs and storage facilities. While the virus is not typically spread through commercial goods themselves, the presence of infected rodent reservoirs in transport containers presents a localized risk for logistics workers and warehouse staff. This has led to the implementation of new surveillance guidelines for port facilities and inland distribution centers, where the focus is on mitigating aerosolization events during the cleaning of transport units. Inside the hospitals, the focus remains on the critical window of transition, where symptoms can rapidly escalate from mild malaise to hantavirus pulmonary syndrome. Medical directors have noted that once the leakage phase begins, where the virus causes blood vessels in the lungs to become permeable, the need for intensive care is immediate. The 2026 reporting cycle emphasizes that the lack of a specific antiviral treatment makes early detection and aggressive oxygen therapy the only viable paths to reducing the high mortality rate. Agencies are now working to bridge the gap between field surveillance and clinical intervention, ensuring that as rodent activity increases due to environmental stressors, the medical infrastructure is prepared to handle the resulting uptick in severe respiratory cases. Prevention and surveillance strategies in 2026 have been forced to evolve alongside the changing environmental conditions that facilitate hantavirus outbreaks. The primary directive from public health agencies remains the elimination of rodent-to-human transmission through rigorous environmental management and the disruption of aerosolization pathways. Because the hantavirus is an enveloped virus, it is biologically fragile outside of its host, yet highly lethal when inhaled in its viable state. To prevent the virus from becoming airborne, health officials have issued a standard wet cleaning protocol for any area suspected of rodent infestation. This process mandates that individuals must never use brooms or vacuum cleaners, as these tools effectively launch microscopic viral particles into the air, where they can remain suspended for extended periods. Instead, the current guidance requires the use of a disinfectant solution, specifically a mixture of 1 part household bleach to 9 parts water. Contaminated surfaces, including droppings and nesting materials, must be thoroughly saturated and left to soak for at least 5 minutes. This period of contact is necessary to ensure the chemical disruption of the viral envelope, rendering the pathogen inactive. Only after this saturation period should the material be wiped up using paper towels or disposable cloths, which must then be sealed in plastic bags for immediate disposal. For those working in high-risk environments such as crawl spaces, sheds, or agricultural storage units, the use of personal protective equipment, specifically non-porous gloves and N95 or higher-rated respirators, is no longer a suggestion but a critical safety requirement beyond individual cleaning practices. The 2026 public health strategy relies heavily on One Health surveillance, an integrated approach that monitors the intersection of animal, human, and environmental health. Surveillance teams are currently deployed in high-risk corridors to conduct trap night studies, which measure rodent density and the prevalence of the virus within those populations before human cases occur. By identifying hotspots where the percentage of infected rodents exceeds historical averages, officials can issue localized warnings to residents and workers. However, there are significant and honest limits to our current knowledge that the scientific community must acknowledge. Despite decades of study, we still lack a commercially available vaccine for the American strains of hantavirus, and no specific antiviral drug has been proven effective in clinical trials once the pulmonary phase has begun. There remains an element of biological unpredictability. While we understand that climate instability drives rodent surges, the exact triggers that cause a virus to spill over into a human population in one specific cabin versus another remain a subject of ongoing research. Furthermore, while the Andes virus strain has demonstrated the potential for person-to-person transmission, the exact mechanisms and the duration of infectiousness in humans are still being quantified through intensive contact tracing data. As we conclude this report, the ethical imperative for public health remains clear, transparency, and calm. Evidence-based guidance are the most effective tools against an invisible threat. The hunting season for hantavirus, amplified by environmental shifts, serves as a stark reminder of the delicate balance between human development and the natural world. Health officials urge the public not to panic but to remain vigilant, particularly during the spring and summer months when rodent activity is at its peak. The shift in our global climate has made the monitoring of zoonotic diseases a permanent fixture of 21st century healthcare, requiring a sustained investment in both laboratory capacity and field surveillance. We must continue to respect the limits of our medical interventions while maximizing the efficacy of our preventative measures. By adhering to established disinfection protocols and supporting the efforts of global surveillance networks, we can mitigate the impact of this high-consequence pathogen. This situation continues to develop, and we will provide further updates as data from the CDC and the WHO is verified and released. For ongoing coverage of global health security and emerging viral threats, consider subscribing to our channel.